Hello, there's been strong criticism today after it emerged that some of our biggest hospitals were said to be dirty and unsafe. Every hospital in England will now face tougher checks after a catalogue of failures at both Colchester and Basildon.
Newspapers, radio and television, the scandal of Basildon's dirty wards has been receiving national attention throughout the day. Then at 10 o'clock this morning, another blow for healthcare in Essex. The chairman of the NHS Trust in Colchester was sacked. Health regulators said Richard Bourne had failed to meet his targets on waiting times, patient safety and leadership. The local radio station BBC Essex found itself deluged with calls from former patients from Basildon, angered at their treatment and worried about the hospital's current state. At one stage, Downing Street stepped in to insist patient safety would be a priority. The source described the situation at Basildon as an isolated incident, in stark contrast to the high quality of care in most hospitals. In a moment, we'll be hearing from the chief executive of Basildon Hospital. Before that, patients themselves described their experience of care on the NHS.
When you lose someone in tragic circumstances, it can be hard to remember the good times. But Barbara Abbott has this precious video of her mum, Kathleen. It was taken in November 2002. Little more than 3 years later, Kathleen was dead. Kathleen had a heart bypass operation in London, but when complications set in, she was transferred to Basildon, where, according to Barbara, she had to suffer 5 months of hell before she died.
She wasn't cared for, which is what you go into hospital to be. She lost all her dignity. She was dirty a lot of the time until we could clean her. She was frightened. And she was not the same person that went into hospital. She basically gave up in the end. She'd had enough.
This is Julie, who lives in Grays. In 2006, her son was admitted to Basildon Hospital with gastroenteritis. He contracted 2 hospital bugs, became gravely ill, and is still suffering the consequences today. Julie says the ward he was on was filthy.
The positioning of the bed was such that because he was on an IV with a cannula, it was next to the commode, and the commode was overflowing all the time onto the floor. I did my best to clean up.
In February 2008, Richard Sherry died in Basildon Hospital. He'd had an operation, but later fell over on his way to the toilet and suffered brain damage. His family is now pursuing a complaint against the hospital.
His treatment was appalling in the wards, and we know my brother would never want anyone else to go through what he went through. It was absolutely terrible. There was no excuse for it. So we're making the complaint, trying to get things changed at the hospital so that nobody else suffers that way. If somebody had complained before my brother died, then perhaps he would still be alive now.
Barbara Abbott had an apology from Basildon Hospital about the way her mother was treated. Her concern now is that nothing has changed. She simply doesn't want more people to suffer in the way her mother did. Mike Liggins, BBC Look East, Basildon.
Well, late this afternoon I spoke to Alan Whittle, the chief executive of Basildon Hospital. He first became aware of the problems on the day of the inspection, but told me he carries out regular checks himself.
I frequently have walkabouts in the hospital, in all the departments, both here and at Allsit Hospital, which is our other hospital, and so too do the members of my executive team. We have a programme of visits and we look at all aspects of care, including the cleaning standards, but we also have a full-time team of cleaning monitors whose sole job is to check on the standard of hospital cleanliness.
So when you went on your walkabout, did you not see that 11 of 12 trolley mattresses were stained, 2 had foul odours, that the blood pressure cuffs and suction machines were dirty and dusty, that half the cubicle curtains were soiled?
Well, I hadn't been personally to the accident and emergency department where those problems were found at that time, but I do know that the trolley mattresses, for example, did have a manufacturer's defect in them, which we should have been aware of and weren't.
What do you say to those complaints about the lack of leadership at both ward and board level?
Well, as far as board level is concerned, clearly with the kind of severity of results of both the hygiene code visit and the concerns generally about the mortality rate, I have had to consider my position, as you'd expect. I was pleased to see that the monitor position on this, the regulator of Foundation Trust, is very clearly that they believe and are confident that the board is able and will deliver continued improvements in the care in the hospital and bring the mortality down even further than we have.
If a lack of leadership at board level and a dirty hospital and higher than expected mortality rates aren't enough to make you go, what would make you go?
Well, I think what would make me go is if I truly believed that the quality of care in the hospital was at the level that is being suggested by these figures. I actually am confident that that is not the case. Hospital safety is our major priority in the Trust and has been for a number of years, and I work alongside superb clinical staff, both doctors and nurses, and I know that there is more to the mortality figure than is being suggested by the headlines that are being shown today.
If there is another surprise inspection that you don't know about, somebody who's trying to see your services from the patient's perspective, and they find that things aren't getting any better, would you then resign?
If I truly believe the hospital services were not of the quality that I would want for my family, then I would consider my position. I don't think they are giving me any cause for concern. I speak to my clinical colleagues daily, as you'd expect, and what I see is dedicated, highly qualified professionals delivering good care, and that's what our patients tell us that they're receiving.
Mr. Whittle, thank you very much.
Thank you.
There's lots more to come on Look East, including a special dispatch from Alex Dunlop, who's a dinner lady from Essex who was sacked after she reported a case of bullying to a parent, has failed to win her job back. Carol Hill was dismissed from her post at a primary school near Colchester in June. Felicity Simper has the details. Felicity.
Well, Carol Hill came out of her hearing around about an hour ago, visibly upset. She told us she'd lost her appeal.
I'm bitterly disappointed with the panel's decision today. I've only ever had the welfare of the children and the school at heart. All I wanted to do was get my old job back. It's been a very difficult time for me and my family, and I've worked at the school for 7 years and I love every minute of it. Living so close to the school and hearing the children playing is heartbreaking. I can't do this.
Do you want me to do it?
Yes.
Well, after she broke down, somebody else did finish that statement for her, but then a few minutes ago, she just spoke to us.
I'm so hurt that people can do this to me when I've tried to help a child. I find it unbelievable. I can't speak anymore. I don't know what to say.
Well, Scott David, the father of 7-year-old Chloe, who was bullied, says the school played down the incident. Chloe was tied to a fence and whipped with a skipping rope by some other pupils, but Scott David says the school merely told them she'd just been hurt with a skipping rope. He's so appalled at the way the school have dealt with the whole situation, he's now taken his complaint to the school secretary, Ed Balls, who's now demanded an investigation, and he's described the school's response to Scott David as totally inadequate. Meanwhile, Carol Hill is now deciding whether to take her case to an industrial tribunal.
Felicity, thank you very much.